the controlling mechanism, the auto control that God has put in our bodies, or whoever created our bodies, let's assume it's God, it stops. It doesn't stop growing because that need is fulfilled. For instance, you get a trauma, you get a wound, that wound needs to heal. It heals by this process of multiplication of these cells. But then the auto control mechanisms kick in and it stops at some point of time. But in a cancer, what happens is these mechanisms do not stop the process of a cancer. To put it in. Now you could go ahead and ask me what your second question is.
Sure. So Dr. Kaul, I think it was really great to know, so much of insight from you in just few minutes, and the people who are going to listen to this chat, actually they are the people, common people who may have come across some information about cancer, but they may not know the real, issues or causes, what it is causing. And I think you very, very quickly and very here that, as you rightly talked about, that carrying extra weight, having the food habits which basically lead to having your body not able to cope up with that, and having situations which could lead to growth, cancerous growth in the body. So I think some of the things you talked about are very, very critical and eye-opening to most of the people on the who will be attending this or who will be listening to this chat. So I just wanted to pick up where you left and take up a little bit further from there to understand your thoughts. That, you talked about first is prevention. I think, and that's where you did talk about that. I think a lot of work is going on, and I think there is a need of a lot of awareness. And I'm sure this chat itself will make people aware that what are the 10 things they should be careful about, or they should be taking into account, whether it's genetic or whether it is, lifestyles, etc. But second thing also, I think I wanted to get your thoughts on about detection, early detection, right? Because you did talk about that most of this part of the world, I think the detection itself takes time. I think probably we are not as much aware of our, developments in our body, and we take them for granted. Or we basically think that it is something which will go away in a few days' time. Or maybe you talked about the God who has created it. I think as Indians are, considered to be very religious people, most of the people think that, God is there to take care of all of us. If we pray well, nothing will happen to us, right? So detection is also one of the critical part. And then the third part, which I understand, is that, treatment, the right type of treatment at a right place with the right advice, and, care becomes very important. And fourth, you did talk about financial aspect of it, because the resources required to cope up with this, it's like a battle, and you need all kind of resources, right? So I think these are the four things which I take as a summary of the discussion. But I wanted to understand from you, Dr. Kaul, that the second part, how much is the detection at the timing of the detection, or how people should ensure that they are going through periodic checks, or what should be the periodicity, so that, even if they have a tendency because of genetic reasons, or because of lifestyle reasons, or because of any other environmental reasons, if they are able to get it detected faster or earlier, probably the chances of survival and the chances of ability to manage this becomes better. Am I correct, sir?
See, Sachin, you've asked actually a whole lot of questions in that one question, but let me go about it very, very, very simply and very, very in a stepwise manner. The first thing is that, yes, it is true that prevention is better than cure. You already talked about it. Now, there are two levels of prevention. One is primary prevention, which means that you make all the lifestyle choices, all the known carcinogens that you know about, that the Agency Against Cancer has already put out from time to time and is in public domain, transmitted by various levels of media to common people, is the fact that you don't allow them to come into your life at all. And you go for things like vaccines. Now there are slowly vaccines getting developed, like for cervical cancer. There's a vaccine for hepatitis, against hepatitis as a cancer. There's a vaccine. And slowly now we are getting a cancer currently being developed even for breast cancer. And it will ultimately come for all the cancers because that's the way our research is growing, and a lot of money is being spent for research across the world currently. So good, and that's primary prevention. The secondary prevention that you talked about is that if you did not prevent it, or you could not prevent it, then what's the next best thing for you to do? And that is to get this cancer early. To put it, and in that process, your second question, meeting the right guy or getting referred from your GP or whichever system you follow to the guy who will give you that answer. Don't just take it lying down. Don't just try to find answers. Use your mind to quench your own curiosity, because for God's sake, it pertains to our life. So very important and powerful. Getting yourself checked out for preventive checks. Why go to a clinic when the car is broken down? Because that's what we've been trained to do. How often do you, if I ask you, Sachin, how often do you really routinely send the car that you go to your office in for a check when it's not even troubling you? Do you?
Really.
You're not
Never.
trained like that. But it's about time we did it, because that's how simple it is. That's where it starts.
Right.
We are basically a product. We are a technical product. Now, if we don't get checked up from time to time as the wear and tear of this world increases and impinges on us, whatever you believe in, whatever is important. Because that not only will save your money, it will save your dignity, it will save your life. That's extremely vital. Is the history of these cancers in your family, or for some particular reason you already have what we call as pre-malignant conditions. There are conditions from where more chances of cancers developing, like the leukoplakia, white patches in the mouth, or erythroplakia, the red patches. Similarly, things what we call as carcinoma in situ. Because like I told you, carcinogenesis, the creation of a cancer, is a multi-step process, usually over decades. Right. So at any point, the picture will be different. So if you get tissues from one of these, you will know this is restless. This area and these cells are restless. They don't want status quo. They're trying to create something nasty. You can take steps. You can pick these situations up if you're going for preventive checks, which is what you must do. Now brings me to the other important thing. Obviously, getting your treatment at the right place is important. And when we talk about treatment as a whole, I can give you little tips of going right, from a patient's perspective. And that's fine. But financial matters that you talked about, there is a term which we are now coming to terms with increasingly all over the world, and more so in India. And that's called financial toxicity. Now, if I told you, like you have side effects, toxicity, vomiting, side effects, adverse effects from whatever you go through, medications, diseases. So also financially, you go down. And if I tell you that even in the most developed parts of this world, which would be North America as on today, there is never enough money for treatment of diseases and cancer. Right. Even they don't have enough money. Even with the financial resources they have, it's not enough. Because with newer science and development, this thing is becoming increasingly difficult to treat financially. There is never enough money to put into the system. So that is why we have now come to a concept of value. We say good value. Please send me, doc, to a place which will give me good value treatment. What is value? Which means that what you get out of that money that you've spent, the energy and the time that you spent, what you get out of that should be more than what you put in. You've got to get that balance right. So, good value medical treatment is our goal. It's not very easy to achieve because this is capital intensive. Got to keep in mind new tests, new drugs coming in every day, new diagnostic tests, molecular tests. They're all very, very, very expensive. So there has to be a payer system which is able to pay into that. And like I told you, there's never enough money even in the most rich part of this world. So we are at the lowest, we're at the bottom. We obviously have more, and most of our expenses here are out of pocket. That's why you'll routinely find where people coming from rural areas having sold off their patches of land and their houses and all that for their treatment, somehow trying to stay alive. It's pathetic, but it's true. I see it all the time. It's heartrending. So, money matters are important because it can cost you anything from 50,000 rupees to 50 lakh rupees to treat your illness. Because such is the varied armamentarium that you're developing against cancer today, be it the radiation machines, be it the costly immunotherapy techniques, be it the targeted therapies, the so-called smart bombs of cancer treatment. Yes, better in every way, but more expensive as well.
Right. No, I think Dr. Saab, we did talk about very, very important aspect. जैसा मैंने देखा भी है कि बीमारी तो आपको मारती ही है, बट साथ में उसके साथ जो फाइनेंशियल चैलेंजेस आते हैं और जो आपने फाइनेंशियल टॉक्सिसिटी की बात की और द लैक ऑफ रिसोर्सेज की बात की, आई थिंक उसका भी बहुत बड़ा इम्पैक्ट पड़ता है इन द मेंटल स्टेट of the patient as well as the support system. And I think the way you talked about that, it could go up to millions of rupees, maybe 40, 50 lakh, maybe more than that also in certain cases. This is something which can break the whole economical sort of backbone of any family, even if one member is detected with such kind of sort of disease, and which is the chances are 1 into 8, right? So practically we are sitting on a sort of a situation wherein the chances of people having this disease has been increasing, and at the same time there are limited financial resources which are available either from government or from private sources otherwise, and coverage for everybody is practically impossible, right? So that's where I think I also wanted to bring to the topic of while the topic is more about awareness, but I think protecting ourselves, if we are into this situation, how do we do that? And that's where I think we talked about, getting healthcare at the right place, which is affordable, which is top class, which is basically, available to the people, so that they are able to afford it. At the same time, the other angle is that, insuring yourself against such potential sort of diseases, because like in India, we have very little focus on thinking about how do we protect ourselves in future against such things, right? And I think it would be important also that the insurance penetration is hardly 1% in India, and health insurance practically negligible. So I think the combination of early detection, care, and the financial resources, I think it would, and obviously prevention, like you mentioned, is equally very, very important. I think these would be the 3-4 factors I see to be able to at least counter in some way to the difficult situation which most of the people in the country are going to face in future. Am I correct, sir?
You're absolutely right, but you know what, Sachin, what I feel is that, like I told you, that the commonest cause of bankruptcy, out-of-pocket bankruptcy in the United States is cancer treatment. As you're aware, it's very clear. Value, sustainable. Also, that equal number of people across the length and breadth of any country, and we are talking about India here, need to be able to access this standard of care.
Yes, absolutely.
It doesn't have to be heterogeneous, good in parts, bad in places, not so good in some other places, depending on whether you can pay for it or not. So you have to improve access of your population to this care. That is not only the duty of your government, it's also your and my duty, because we have to insist on it. Our representatives, community-wise, public opinion has to be built up. So, number 3, keeping, like Make in India, again, let me talk about was one way of bringing costs down. Encourage indigenous research and development, not copycat research, bench research that will actually produce better armamentarium, better drugs, right here in India, because that's the only way you can be able to keep the costs down. So, creating all that in India is important. Getting the doctor-patient ratios is important. The distribution of these services across the country has to be uniform. That's important. So it's not just one thing. There's a whole lot of things. But like I said, we are the cell, the basic microscopic cell of this whole system. So our role cannot be denied, nor can it be ignored, nor should it be taken lightly. So that is why it's important to create awareness in everybody. Mind space, allocating a budget to it, keeping your bodies fit, getting awareness and distributing it around you, insisting it of the right things of your government and hoping that they comply. These are all important. This is a multifactorial thing. It's teamwork. Nothing is individual forays anymore. No sort of lights, my friend. It has to all be in tandem with each other. And
Right.
that's the way.
Absolutely, sir. So, Dr. Kaul, wonderful talking to you on this. I think, we can go on with the amount of, the wealth of knowledge you have, the experience you have. I think we will probably get another opportunity to talk to you with your kind consent in future on this topic. But I think this would be a wonderful episode for our audience today to know about, get the awareness about cancer, know about how, what could be the potential causes, how to sort of prevent it or at least minimize the chances of happening, how to look at, early detection done, and then also manage their, the whole financial well-being part of it in terms of basically getting it treated at the right place, get the value for the treatment, as well as securing their future and their family's future from, getting any kind of sort of insurance or any kind of other protections from either government or from other, bodies. So I think this would be, really, really interesting for our audience to know, and we look forward to the feedback from audience. And thank you, Dr. Kaul, for being here with us. It was wonderful talking to you, and thank you for your time.
I would say thank you, but I would leave you people, everyone, including you, Sachin, with this point. Number one, create mind space for health in your own self. Number two, impinge on your community around you to get insured. Because they don't consider it, and then I see them suffering, and it's really not a happy moment at all. It's excruciating for people who think to see people around them suffering just because they didn't at the right time consider something as simple as health insurance. These products in the market need to get better. They need to get, but like I said, all this is fine. These are instruments, but all this has to be dealt with
Right.
through an emotion of compassion,
Absolutely.
helpfulness, value. These are important words. Let's drive them into the system. And goodbye.
Absolutely. Thank you, sir. Wonderful.